Wonderful.
You'll do great. Just
All right.
talk to me and not the camera.
We're on live. We're on live.
We're on live.
We're on live.
Okay.
We're in Los Angeles, West Hollywood. It's gorgeous out. End of the day. We're doing a peeling training, a peeling seminar right now with Rep Feel. I'm sorry to laughing.
It's
My
Rep Feel.
social team is making us laugh. And one of my best friends is here. And we're going to peel our hands because we always talk about the importance. I'm sorry, you guys, stop making me laugh.
Yeah.
Because the importance of peeling not only your face, neck, and chest, treating those areas, but your hands. Because your hands are always sun exposed. And we got to treat those areas too. So we take a look up close. My patient's hands are amazing because we just did a laser. So now we're going to do the maintenance treatments where we're going to start treating with the peel. And what's important when you do with the peel, you go all the way down onto the fingers. You can even do up into the arms if you wanted. But what I want, the key thing, and I think that my patient should tell you, is that she has already been treating her hands with skincare. She did lasers. She has literally prepped and gotten ready to do this peel because she also did the lasers. So what I want you to see is, I'm gonna let it sit for a second before we do the other side. Because the result we want to see is what? What do we want to see?
I want to see the sun damage take off, and this peel, the red peel, contains salicylic, phenol, TCA, and lactic. It's a media depth. It's wonderful on the hands, on the whole bodies. It's perfect after lasers.
Tell me why. Explain to me, because I'm in a full agreement. When I was a fellow, we used to take these big bottles of chemicals and just mix them together and do these really strong peels.
Mm-hmm.
But I'm more of a candidate of taking smaller doses of chemicals and putting them together to get deeper penetration without as much downtime.
Yeah.
So that's why we have these combinations of the phenol, the TCA, the lactic, the salicylic.
Yeah, it's
right?
It's better than just straight TCA 35%.
Tell me why. Why is that?
Okay, because the phenol is the small molecule is really help you penetrate in. Okay, and the red peel is the only peel is blended in the oil essence delivery vehicle and will help you the even penetration.
I love that. So oil gives you more even of a penetration, so it's more controlled.
Yeah, it's more
which is what we love. We love that. As a dermatologist, we want to make sure everything's consistent and even. How does this feel?
Like nothing.
I love that. So one thing, you guys, a little trick, just so you know, for those of you that work on your feet all the time, you're an esthetician, you're a waitress, stay-at-home mom, whatever, you're on your feet all the time, high heels, and you get thickness, calluses, things like that on your feet, you can peel the bottom of your feet. And you can do, because a lot of this will penetrate into this, and you can debride all the dead skin, get your pedicure, and then do the peel, and you can have the Cinderella foot. That's what I call it.
That's wonderful. Yeah.
Okay, but here we're not looking for major frosting. This isn't a aggressive peel, right?
Yeah.
What are we looking for?
We're looking for the severe redness.
Mm-hmm. Which we got, and I'm really pushing this into the skin.
How many coats we have done?
4.
4 coats, right? How do you feel?
Feels like nothing, and I didn't put any numbing cream or anything.
Yeah, you cannot put a numbing cream because we don't want to neutralize the peel.
Exactly.
And I haven't taken any medication or anything for
That's
numbing.
wonderful because it's also this is why it's better than the traditional TCA 35%. If you do the traditional TCA 35%, it will be very painful now.
Very
right?
painful.
Mm-hmm.
Mm-hmm.
Yeah. And so it's easy and simple. Is you can handle it, right? Tolerable.
Yeah, that's fine.
What I want to see for her in the next couple of days is some tightening of that skin. I want to see that skin tighten. I want to see a little bit of peeling, and that's it. That's what we want to see. And then over time, the crepiness and the sunspots will start to go away. And you can do these peels in between your lasers, in between your microneedling, in between other treatments that you normally would do on the hands, face, neck, or chest. This is a great combination peel for overall rejuvenation.
Yeah.
Don't you think? do.
I would love you put a lot of retinol every night.
That's what she's gonna do.
Yeah, in the next 7 to 10 days, 2 weeks.
Our goal, we're gonna give her, she has a full regimen.
Mhm.
She already has great skincare. The one thing we're gonna do primarily is doing retinol a couple times a day.
Yeah.
That's gonna be really important. We wanna get flaking
Yeah.
of the skin. But that's it, guys. That's overall rejuvenation of the hands for crepiness and sun damage. The goal here is not necessarily just cosmetic. There's medical purposes to treat the hands. Skin cancers occur significantly on the hands, and so you need to do peels and lasers and skincare to prevent you from getting skin cancers in those areas. Have a good day.
Wonderful.
You were making me
great.
laugh.
You did great.